Now we move on to the next session. We have four talks back to back, and this session will be chaired by Dr. Annamalai Vijayaraghavan. The first talk will be on transition to adulthood and autism by Dr.A.Somasundaram.
Good afternoon to all of you. I thank the organizers for inviting me to chair this session. I would like to introduce Dr. A. Somasundaram, who is known to me for many years. He is the co-founder and chief mentor of DSOL Child Development Center, and he has a decade of experience in child development and has extensive knowledge in planning and implementing intervention programs for children with autism, ADHD, learning disabilities. He is an excellent speaker and he has spoken in many conferences and an active member of the IAP. He has been an office bearer for many years. And now he is going to talk on transition to adulthood of ASD children. And from the statistics previously, 10 years ago, more than 60% of them did not undergo this transition either into employment or education. And about 1/3 of them were disconnected for many years, and because of not a proper planning. I'm sure Dr. Somasundaram will tell us the approach, the planning, and how to go about this transition.
So, happy evening to one and all here. So over the next, so thank you the organizers for giving me this topic on transition to adulthood in an autistic child, because we all pediatricians are known to have exposures with a lot of children with autism. But what will happen if these children stay autistic and then get transferred or they get a transition into an adulthood stage? So over the next 15 minutes, and with respects to all my people here and the Dr. Kumaresan and Jayantri, and thanks to the Su Dio, I think both are not here, the Subbu and Sudhakar Dio, who has given us this opportunity to host this conference here. And we all know that, to take a foot into the topic, we know that now we have all mentally known that autism is not a language disorder. It is a problem where a child is not able to connect, interact and engage with others meaningfully since birth. So the problem is with the engagement and connect. It is because of this lack of connect and interaction, the child is not able to learn meaningful things from other people, including the language skills, which the child is not able to learn. And why conferences are including more and more autism talks? Because it is not a rare condition. It is not a disorder of the Western world. It is a common condition in the Indian subcontinent. Is it going to be extinct? No. In fact, it is increasing day by day. When I was doing my post-graduation days way back in 2000, the autism incidence was 1 in 150. And now it is 1 in 36. So probably if 100 babies are born, 3 babies are going to be autistic. If I am going to see a baby at 6 months, the chance that it is going to be autistic is 1:36. So what has changed recently? We thought initially autism is a medical disease, and most of the parents, after the counseling for an autistic child, they ask me, "Sir, konamairuma, will this disease get cured?" So first, this is not a medical disease to hunt for cure. This is a problem of a delay in the development, a deviation in the development, where the child has to be promoted to overcome the delay, overcome the deviation, and overcome the regression, whatever it's there. So the focus has shifted from a disease to a disability. It is not a disease. It is a disability where the child is not able to learn the skills from the environment. So it has moved from a medical model to a social model. How it can be, medicine is not going to be the treatment. How the society is going to help these children with the disability to overcome their issues. So it is a variant of normal human development and human diversity. So that is the thing which every pediatrician should be knowing about that. So it is moving forward from fixing the disability. It is not, okay, you are not walking, I am going to make you walk. You are not talking, I am going to make you talk, I am going to make you verbal. It is not like that. How am I going to integrate this child in future into the society? And that is by these F words. Their function should be there, their family should be enabled, they should have fun, they should have fitness, they should have friends, and they should have a future. So this F words should be enabled in these children so that they can be integrated into the society. And coming to the topic, diagnosing autism is not a one-time diagnostic treatment or a service, but it opens the door to a lifespan approach to a social care of such individuals. So that is, it's a diagnosis as an open one into which the child is now going. And this is the query which every child, every parent with an autistic child who is going into an adolescent stage will be having. Is adolescent in children with ASD like that of my neurotypical peers? Like my other adolescent boy, this boy will also have a normal adolescence? Do the core symptoms of autism, we all know what are the core symptoms which I will be demonstrating in the next slide, whether they will come down, whether they will plateau or they will increase during the adolescence. What are the challenges which we expect while these children transition to the adolescent? And finally, how am I going to intervene this? We all know these are the three core symptoms. The child is not able to socially interact. The child is not having to able to have a social communication. The child is going to have a restricted interest and then repetitive behavior. So this is these core symptoms. These core symptoms usually stay as the child grows on also, and whether these symptoms will go on as days goes or they are going to stay in the adolescent period. We all know, everybody wants this. Variety is the spice of life. You want to go into a restaurant, you want to have Thai restaurant one day, Japanese restaurant the other day, North Indian on the other day, and the South Indian other day. But the problem with the ASD is variety does not spice up their lives. Rather, it is the constancy that gives them stability. They don't want the change at all. But adolescent is not such a period. Adolescent is a period where change constantly occurs in their body, in their mental thinking, and everything there is a change. And these people with this autistic behavior, they don't like that. So change is very difficult and they construed differently by the individual with autism. Changes in many domains happen during adolescence and have potential implications. So I'll just take you to 3 case stories which will show you how these challenges these children are facing. Nisha was faced with a challenge that most children of her age wouldn't even dream of encountering. At the tender age of 10, she hit the precocious puberty. Her mother had barely completed toilet training for her because she is an autistic child and toilet training was completed by 10 years. With the help of a pediatric endo, her cycles were deferred for another 2 years. During this period, Nisha was educated about her menstrual cycle. She learned how to wear pads and expressed any discomfort. Nisha's mother got a special innerwear designed to keep the menstrual pads in place. Nisha had learned how to manage the cycle effectively and is no longer a hindrance to her. So such is the effect the mother has to put for 2 years to teach her how she has to handle her menstrual cycles. This is the second scenario. A 14-year-old boy was displaying inappropriate sexual behavior by exposing himself and holding his private parts in public. The issue is he could not understand social cues because of his cognitive levels. A firm-fitting underwear was advised by the therapist, but because of the issues, the boy was not able to do that. So what the parents did, they introduced trunks along with the loose cotton pants instead of the shorts. And he was provided with a comfortable fabric and color choices of his liking. So this changed his behavior and now he is not doing this inappropriate sexual behavior. A mom of a 15-year-old girl had saved many months so that she could give her daughter a first-time flight experience. Contrary to her expectations, the girl stripped down her dresses and refused to wear anything else. The air hostess could not wear the safety belt for her. She did not want to be confined to the closed cabin. The airport authorities deemed her unfit for air travel. So such are the challenges, social challenges, sexual challenges, puberty advice, everything the parents with autistic children are facing day by day. And such is the big list of challenges. Preparing for the puberty, safety in these children with autism, sexual behavior, teaching of appropriate sexual behavior, how to have a social behavior in these children, teaching them life skills, what living arrangement am I going to give this child. If I die as a parent, I am a single parent, if I die, where will this child live? Is the child going to go for an institutional care, or is the child going for a foster care? Vocational training. This child has got a good cognitive level. So what vocational training can I give him? Education. And I am a parent. I also need to live. How am I going to take care of my well-being? So preparing for puberty, we have seen the case scenario. The parent has to teach the child how to take care about the periods, what is menstruation, because initially the child, the preparing for the menstrual cycle, girls may be initially frightened because they have not at all experienced such things. That they are injured, they are having some sickness. They need to be reassured that this bleeding is normal, and teach them a social narrative that, okay, fine, this is the thing which is happening in a woman, and they show them pictures and everything. For an adolescent boy, shaving is very, very difficult. We have seen many autistic boys without a shaven faces and those things, because of their sensory issues. They can't shave with a razor. So what they advise is, they can try an electric razor is a better option, but sometimes people with ASD may be sensitive to the sound which the electric razor is making. So that will also be a troublesome one. Wearing appropriate undergarments. People with this autistic behavior, they don't like close-fitting, tight-fitting undergarments. Adding a new item to the dressing routine can sometimes be uncomfortable. So try different styles of undergarments like a brassiere or an underwear which fits well, and what is a comfortable should be there. Safety, very, very important. Sexual safety and privacy safety. So teach appropriate sex education, because all these children, they are all human beings, they are sexual beings also. They also have the same feelings what another adolescent boy has. So teach them appropriate, age appropriate sexual education, teach them on hygiene, teach them on healthy relationship, teach them on contraception, teach them on sexually transmitted infections also. Concept of privacy, very, very important. Use picture to teach the private body parts, to inform the parents if they feel violated by the other individuals. Teach them about the activities that should not be performed in the public and that can be performed in the public. So this has to be taught to these children about safety. Sexual behavior, teach appropriate behavior around masturbation. Explain that it is a private activity and not to be done in the social settings. Use pictures and social stories to explain the rules. Sexuality education has to be given from parents, because see, other adolescents can learn sexual education from movies or from their peers or something like, but these children, they don't have peers. So only the parents can teach them what is sexuality, what is sexual education and those things. Internet safety. So sexting, cyberbullying, everything has to be taught by the parent using pictorials, everything to be through movies and those things. Social behavior training. Social behavior, very, very important, because as we all found, we all know, social domain is the very weakest and needs to be developed gradually. Teach them words such as please, sorry, thank you, everything. Role playing to these children. Use social stories, video modeling. Social priming is very, very important, because very difficult to take these children to celebrations and functions. So you should show them photographs of past celebrations, such what this event will be like, or what will you do when you go there, and if they are still resistant, take them to the event after everybody has dispersed, when there is a less crowd in the event. So such is the thing which the social priming has to be done for these children. Teaching life skills, very, very important, daily living skills, because the child has to learn them. How to maintain the hygiene, how to bath, how to brush, how to do the toileting. Grooming is very, very important, shaving, hairstyling, nail care should be done. Dressing, how to find that the cloth is dirty, how to find out which is the right side, which is the inner side, outer side, everything. The daily routines has to be taught to these children. How to go for, what is the daily routine from morning to evening and those things. Functional skills has to be taught. About healthy diet, what are the 3 meal plans, what is the balanced diet, everything has to be. How can the diet be eaten hot or warm, what diet should be eaten cold, how to use a phone, home care, how to switch off the lights, when to switch on the lights, when to switch off the lights, how to save electricity, everything has to be told about to them. Money management, how to spend money, what is the money currency, everything has to be taught. Transportation, how to use an auto, how to use a bus, how to use a train. Shopping, how to shop for their needs. Technology has to be taught to these children. Health and safety skills has to be taught. How to keep them fit, exercise, medication, how to take the medication, how to, first aid, it is first aid. How to take first aid when you have an injury or some other issues. Common health symptoms you have to teach them. How to identify that you are having a fever, how to identify you have a stomach pain, and all these things has to be taught to these children. Coming to the living arrangements that I told you that very, very important, because a mother may die, a father may die, single parent can be there, but where will this child go? Depending upon the cognitive level and the adaptability the child will be living. The child can either live in an independent living, best suited for young adults who have learned the critical safety and life skills needed to live on their own. They can be on a supervised living. The young adult may live with their parents, relatives, or a family friend as a roommate. So this is a supervised by the family friend or the relative. Supported living. Here the young adult lives in a home, apartment, or a group and receives daily ongoing support from a caregiver or an agency for check-in and assistance with their daily needs. So these are the three various forms of living which are options for children with autistic in the adulthood stage or adult stage. What are the types of supported living? Cooperative living. Cooperative living means 3 or 4 autistic children are dependable like adults. They join home, they join and then they live in a home. That is called as cooperative living. Supervised apartment is similar to our college dormitory. There will be a supervisor in the apartment. Then there will be 4 or 5 people who have a disability or various disability. Supervised home living, group home living, that is also by your supervisor will be there. Adult foster care, this child will be in some other person's adult care. They will be in an adult home. Institutional care, where there will be a medical help also will be there, that is an institutional care. This is, at this juncture I should also tell about this autism village in Telangana, a 10-acre township where they have, this gentleman, I think it's Kubra. So he has constructed this autism village. 84 apartments are there. All are families of children with autism. So, and this Ananda also. Vocational planning, very, very important, will depend upon the age, will depend upon the communication ability, sensory sensitivity, adaptive functioning, and they all do well in a structured environment. Why they are very, very good in employment? Because they are non-verbal. So they will less likely to verbally disrupt the co-workers. They have limited social interest, so they will not waste time at all. They will be focused in the work. They have strong sensory preferences. People who have strong periphery preferences enjoy working in a quiet office. They will work for long hours. Is very schedule or rule bound. So comes to work on time, takes breaks at the right time, returns home to work on the right time. So they won't loot. Appears ritualistic or compulsive. More often excellent attention to the detail. Quality control kudutamna, they will work well. So individuals with a better cognitive and adaptive functioning, technology or computer related labs, data analysis, banking, programming, they can keep them. Science and research, good people, you can put them in research labs. Art and design, they can put it in animation, fashion designing and those things. Individuals with a lower cognitive functioning, you can put it in packaging industry, pickle packing, soap packing, stores, like retail stores, everything. Assembly work, carpentry, automobile assembling and related thing. Landscaping and gardening, animal care, pet care hospital and all, they will do a good work. Food service, cooking, baking, setting, dishwashing, everything they can go to work. Housekeeping in hotels and cleaning jobs in apartments can be done. Education, depending upon the cognitive level and their adaptability, you can fit them into an inclusive education. Flexibility, choose skill-based subjects they can choose, because all this, the amendment of the People with Disability Act 2018 has made lot of amendments to the education, and exemption from second and third language are there. Home-based instruction can be given. Discrete trial training can also be an option. Parental well-being, finally, is very, very important. You can't pour from an empty cup. Take care of yourself. Very, very important. The parent's life is changed after the diagnosis. Once you say a diagnosis, their life is totally changed. Most parents feel they are on a lonely boat with no kith and kin, but it's important to look after themselves. Tips for the parents: hold on to the job, probably a part-time job or without a break. Most parents ask me, sir, should I take a break and look after my child? I'll say this is early intervention. Probably you can do more effort for the child. Probably 6 months later you have to take a good work or a part-time work. Look for trusted caregivers and domestic help who are humane and considerate. Take a break and travel. Very, very important. Don't deprive yourself of legitimate joys in life. Dress smartly and Be optimistic. That is the tips for the parents with these autistic children. Finally, realize there is no size fits all when it comes to autism. You have to individualize your care to the children. The needs of one may be vastly different to the next. You must put in time to establish a rapport to find an individual strength and need. That is called transitional planning. You have to find out the goals, you have to find out what are their strengths, what are their weaknesses, and draft a plan for their long life. If you have met to an individual with autism, you have met only one individual with autism. That is the saying by Stephen Shore, because every autistic is different. There are a lot of success stories. This is the first boy who was diagnosed with autistic by Leo Kanner. He is Donald Gray triplet. He has now gone into the geriatric age group. He is now almost 90 years old, and he is still living, and he has written his book on his own autography. And these are the famous people who are in the autistic spectrum, and they have done wonders to the world. And success will depend upon early intervention is very, very important. Lot of kids are being brought to the normal stream and spectrum, out of the spectrum by your early intervention. Early intervention, the success will depend upon 4 years, which I have coined, the starting age of therapy, when you start the therapy. At 11 months early intervention or 4.5 years intervention. Severity of the problem, what spectrum or what severity the child lies. Skill of the therapist, who does the therapy for you. Sincerity of the parent, are you doing center shopping or are you going to stick on for I'll ask the parent, if the child fails in the first term examination, will you change the school? No. Then why are you changing the center after 3 months? So stick on to the center. So finally, I will finish with these words. Regard developmental examination as an essential part of everyday practice with a minimum of equipment, ordinary mixed clinic, no special room or special time or special complicated equipment or by a special doctor by Ronald Dillingworth. It is who and me who have to do in the normal pediatric clinic, and we do immunization service, well baby clinic, nutrition advice, emergency room services, PICU services. But when we talk about growth and development, our response will be this. It should not be like this, and we all should strive to work for these children with developmental delays and disabilities. And this is the team which is helping me to help all these children with developmental disabilities. Thank you for your patient hearing, and thank you for this opportunity.
Thank you, Dr. Somasundaram. Thank you, Dr. Somasundaram, for your excellent talk on the transition to adulthood, starting right from the changes which occur during puberty, how to go about it. And also you have touched on the social skills, how to teach them, functional skills, health and safety skills. At each stage you have dealt very nicely about the living arrangement. You have stressed a lot, and also gave an example of a person from Andhra who has dedicated for these children, and about the occasional planning based on the characteristics of the child. So all these things are very important, and finally you also stressed on the success of this method of transition, how to go about it.